Kokila, you can start now.
Okay. Vanakkam. Thank you all for joining us today. Today is our last event in KOFOS 2020. The sole purpose of this event is to create awareness about the deaf people to the general public. Okay, so for that, today we have Dr. Balasubramaniam 𝗬𝗙𝗧𝗏, very sorry, Balasubramaniam 𝗬𝗙𝗧𝗏 here to talk with us. Thank you all again. Janice, can you please introduce the speaker?
Thank you, Kokila. We feel honored and privileged in welcoming Dr. Balasubramaniam 𝗬𝗙𝗧𝗏 sir to our event on behalf of SIMSA. He has done his MBBS and MS Otolaryngology in Madras Medical College. He has done his research on fungal sinusitis. He has contributed so much to medicine through his 107 publications, 35,342 reads, and 21 citations. He has a rich work experience as assistant professor and professor of ENT in various reputed medical colleges of Tamil Nadu. He is a medical superintendent in Stanley Medical College and Registrar, Tamil Nadu Dr. MGR Medical University. He has received the Best Doctor Award from Government of Tamil Nadu and from Indian Medical Association. I wouldn't be able to conclude my introduction if I were to list all the journal publications and books penned by him. Thank you so much for joining us, sir. Over to you, sir.
Thank you very much for your nice introduction, Janice.
Thank you, sir. I must thank Think Change Foundation for helping us to contact you, and thank you so much for accepting our request.
Thank you very much. Thank you very much. I feel privileged to be with you kids. Really nice to see you. I love interacting with youngsters. The moment I start speaking to you, I feel younger. I learn a lot from you. In fact, I confess that I learned a lot from my postgraduate students than my teachers. That is real truth, because my students are my teachers, because they goad me to grow, get higher. They make me work. Even if I feel that I'm working about 6 hours a day, I owe it to my students. Thank you very much, kids. Thank you very much for putting me where I am. Very nice of you. And I would like to thank Kiran and all of you for having me in this platform. In fact, today, as the organizers have told me, this is going to be a session on how to prevent problems from occurring in the ear and how to ensure that you retain your hearing, say up to the manageable hearing up to your last breath. So that is what we should aim at. And at the outset, let me tell you, among all the sense organ, the first sense organ to complete its development is the ear. Earliest to complete its development is the ear. And you'll be surprised to learn that a 3-month-old child inside the womb will be able to hear his or her mother's voice. So by the 3rd month of gestation, the child's auditory sense is fully developed. So our mythological stories, which says in Mahabharata, Abhimanyu learned how to break Chakravyuga from his uncle Krishna when he was inside the womb, is very much plausible, because the hearing sensation is known to complete its development by the 3rd month of gestation. So what insult that happens to the hearing of a child would have happened by the 3rd month of gestation. So that is the reason why we always insist on pregnant mothers not to take any tablets during the first 3-month window. That is the first warning I sound to everybody, every potential mother and every mother among you, to not to take any pills during the first 3 months of gestation, because that is the time when the child is most vulnerable as far as the hearing is concerned. Even a painkiller can cause problems with hearing in a child at a later age. So what we should do is don't take any pills during the first 3 months of your pregnancy. Even after that, you should take pills only on the advice of your gynecologist or obstetrician. So that is the first thing we should know. And anything on your face adds beauty to it. Be it nose, be it ear, be it your lips. They really, and of course, not forgetting your eyes, they add beauty to your face. And ear per se also adds beauty to your face. So I see the pinna is the most prominent part which of the hearing mechanism which you see on your head. So what happens is, I see a lot of girls, they love to wear earrings. There is always a science behind where to wear earrings. So I see girls, modern girls today, they wear earrings all around the ear. In fact, I will remove my headset and tell you, they wear all around the ear. The ideal place is the lobule. The ear lobule is the best place to wear your ear studs or rings. To make a hole, that is the best place, for the simple reason there are no cartilage inside that area. So that is the only portion of your outer ear without cartilage is going to be the lobule of the ear. So that is where you can safely poke and create a hole and start wearing your ear studs. But where the other places which these kids, our kids right now, they are wearing, they are highly dangerous, let me tell you, because these areas are cartilaginous areas. Supposing while ear boring, putting a hole in the areas other than the ear lobule will cause a potential source of infection to the cartilage. If the cartilage gets infected, it is a point of no return. Your ear will get shrunken. You will come out to end up with a cauliflower ear. Supposing you are very, very fond of wearing ear ornaments all around your pinna, beware, take proper precautions, take proper aseptic precautions before you put a hole there and start wearing a ear studs. So you should always wear ear studs in the lobule. And if you are keen to wear your ear studs anywhere else in your pinna, you ensure that you take proper, clean, aseptic precautions so that infection will not occur there. Next common thing which I see these children now they do is they start wearing, they are fond of earrings. Supposing you wear earrings inside your, in your ear lobule, of course, once in a while you can wear, but continuously if you start wearing, what will happen is the hole will become large. So you would have seen your mother, your sister, or your friends, they have a large hole in the ear lobule and they need to go for a ear lobule stitch. So in order to avoid all these things, if at all you want to wear a earring, you wear it only occasionally and wear it only for a short duration of time. So when you go for a party or when you go for an outing, you ensure you wear the earring for a ring for just a couple of hours or so. When you get back to home, you always change the earring to a stud. Stud is always safer than your earrings because the earrings, it has a tendency to get caught in your clothing, and when you try to pull it out, it could damage your lobule. Sometimes when it starts to rotate, it will enlarge the hole in the ear lobule, and thereby there will come a time when you won't be able to wear the earring because the hole would have become too large, and then you need to go to a doctor to ensure that you stitch up that hole. So that is one important thing which you should not do. That is a caution I am sounding to our children. Next is, I am telling you, I have been starting about the beauty of the pinna or the outer ear. The outer ear has a very unique function. So supposing if you don't have an outer ear, you won't know where the sound is coming from. The outer ear should be there to localize the direction of the sound. So the main function of the outer ear is to localize where the sound is coming from. That is one important function of the outer ear. The next important function is it should filter out unwanted noises. So it serves as a first pass band filter. So it filters the low ambient environmental noise like hiss of the wind and all that. When you are on a conversational mode, it will filter out these unwanted sounds, and it will ensure that you are able to listen to the speaker in a convenient way and in an audible way. So that is the beauty of the external ear. And every one of you will know, you would have just pulled a pin and you would have seen what is inside. So it is not a straight tube, it is actually an angulated tube. You won't be easily seeing the eardrum by just looking into the pinna. You need to pull the pinna to straighten the ear canal, then only you'll be able to see the eardrum. Why nature has designed the ear canal to be in an angulated way is to prevent insects, ants from immediately traumatizing your eardrum. So if it is angulated, it is that much makes it that much difficult for the insect to get immediately into the ear and traumatize your external eardrum. So eardrum is one of the important thing which ensures that sound is conducted from the atmosphere into the medullary cavity. And every one of you will know, because if you have studied in your biology, you will know that the eardrum is the important structure that allows sound to be conducted from the external ear to the middle ear. And there are three small bones which every one of you would be knowing from your school days: malleus, incus, and stapes. And these bones faithfully transmit the vibrations of the eardrum to the inner ear. That's how basically the sound mechanism occurs. So what happens is, this eardrum is actually a barrier between the outer ear and the medullary cavity. So the next common problems can occur in the eardrum. So what happens in children? This common problem in children is the children will normally go to bed. The child will normally go to bed and suddenly wake up screaming. So why this screaming will be there? The mother will know the child is having ear pain. The child will put his fingers into the ear and try to pull the ear and will start screaming. So ear pain is the most intolerable pain a person can have. So it's very difficult to withstand pain within the ear. So in a kid, commonly ear pain occurs. The child normally goes to bed and then wakes up in the night and then starts screaming because the ear is paining. Why the ear is paining? What happens is the eustachian tube. Everyone will be knowing about the eustachian tube, the small pipe that connects the middle ear to the throat, upper portion of your throat. So what happens is that tube helps to neutralize the pressure or equalize the pressure with the middle ear cavity. So the middle ear cavity, air pressure within the middle ear cavity more or less matches with that of the atmospheric air because of the presence of eustachian tube. Supposing if there is a block in the eustachian tube, the pressure equalization won't be there. On the middle ear, there will be a relative vacuum in the middle ear cavity, and fluid starts to fill into the vacuum, and the external drum starts to bulge outside into the external auditory canal, and there will be excruciating pain for the child. So the commonest cause of child crying late in the night or early in the morning is because of the ear pain. And this ear pain normally occurs in children who are bottle fed. So that is why doctors always insist on feeding your child with the nature's best resource, that is the breast milk. So we always insist on feeding your child using your breast milk and not your bottle feed. So breast milk will always help in preventing this episode of acute pain in the ear or acute otitis media. So the number of incidents of acute otitis media is less in breastfed children when compared to the bottle fed ones. So that is very, very important. So we should always ensure that during the first 3 months of their infancy, the child should be compulsorily breastfed by the mother. That is a minimum duration which we insist, but ultimately we will like the mother to continue breastfeeding the child at least for 6 to 8 months. So that is the duration. So that breastfeeding will prevent the child from landing up with acute otitis media. So the almost 30 to 40% of the deafness due to middle ear conditions are developed during their early childhood. So the parents has got a huge role to play or to ensure that their children don't lose their hearing early in their infancy. So what happened? The next common problem which can occur is the insect or ant or some worm getting into the ear. That commonly occurs during late in the night. You will go to bed normally, suddenly you will wake up that sensing there is something gone inside the ear. The first thing you should do is you should not panic, because you won't be able to seek medical attention immediately, and the affected individual, be it a child or an adult, will be really uncomfortable, because ear is highly sensitive organ. So whenever there is an insect or ant in your ear, that will create a lot of problems. You will become so restless, and this is where a calm head will play a role. So you cannot immediately rush to hospital, and no one will be there to immediately give relief to you. So the first thing you should do is, whenever you are sure that some insect has gone into the ear, all you got to do is, first thing is pour water into the ear. First thing is pour water into the ear. Don't use any instrument, just pour water into the ear. But while pouring water into the ear, the first precaution you should take is, the water which you pour into the ear should be more or less just about body temperature. I repeat again, when you want to pour water into the ear, you ensure that it should be lukewarm. You use the term lukewarm. So when you put your finger in the water, it should not be hot, neither it should be cold. So it should be lukewarm. You should feel as if you're touching your body. So that should be the ideal temperature. So if you pour that water, say approximately the body temperature, you need not use a thermometer to ensure that the water you are going to pour into the ear is of the body temperature. You just put your finger, that'll do. The finger, you should not feel very hot, neither you should feel very cold. So you pour water into here, two things will happen. The insect will die, and sometimes what could happen is, when you pour water, when you tilt the head to the floor, the insect can come out of the water. That is a very good possibility. Still, even after pouring water, you're not getting any relief. The second step is, you can use coconut oil. So if the first step is not working, the second step will definitely work. So you ensure that you use your ink filler and put just ordinary coconut oil. Don't warm, don't heat, don't do anything. Don't add camphor to it, not needed. Just use raw coconut oil. I know many of you are many of you would have tried adding coconut, camphor to coconut oil, and all these home remedies are well known to your mom and dad. But still, I am telling you, the common mistakes they do is, they will heat the water and pour hot water. The moment they pour too hot or too cold water into the ear, you will feel immediately giddy. You will feel giddy, you may even fall. So that is the reason why I insist that whenever you want to pour water into the ear, you ensure that the water is only lukewarm, or roughly about the temperature your body is normally supposed to have. So that is the reason why I stress that. And then even coconut oil, when you want to pour coconut oil, don't warm the oil, don't add camphor to it, just put coconut oil, and you ensure that you completely fill the ear. You completely, otherwise, if you put two drops is not sufficient. Even if you want to add water, pour water, you ensure that you completely fill the ear canal with water, so that it should overflow. It should, whatever water you have poured, it should come out. It should overflow outside your ear. Similarly, when you want to add water, you add oil. You just pour oil into the external aortic canal in such a way that surplus oil should flow out of the ear. So that is the amount of oil or water you're supposed to use if you are affected by insect or mosquito getting into the ear. So that by doing these two things, you can wait, and the insect will definitely die. If it did not die with water, it will definitely die with oil. So after applying all these things, still if you feel that you are not so comfortable, don't attempt to remove, don't throw light into the ear and try to remove what you see. Don't ever do that. You just go to a doctor to seek medical attention. But never ever attempt to remove foreign body from the ear on your own, or don't ask your parents, or don't ask your peers, or don't ask your brother or sister to do it for you, because even a small movement, inadvertent movement on your part could damage the eardrum. So the eardrum is so sensitive, and if it gets torn, immediately you will lose 30 to 40% of your hearing ability. So if the eardrum is torn, you will lose 30 to 40% of your hearing disability. So next common thing the patients come to seek medical attention is having discharge in the ear. So this discharge in the ear is commonly caused due to infections affecting the middle ear cavity. So the infection affecting the middle ear cavity will cause secretions to accumulate in the middle ear cavity, and from the middle ear cavity it cannot drain outside. So any secretions within the middle ear cavity should come out. So the easiest way for it to come out is to perforate the eardrum, and it will come out through the small opening. So this ear hole or perforated eardrum can cause deafness. Depending on the size of the perforation, the quantum of deafness also can vary. So if the perforation is very small, the deafness will be around 10 to 15%. If the perforation is reasonably big, so it will be around 30 to 40% deafness. So deafness is definitely will occur in all patients who have a perforated eardrum due to infection of the middle ear cavity. So the next common thing which can happen is, if somebody would have slapped you, the moment somebody slaps you, what happens is you will hear a ringing sound on your ear, and suddenly you will feel that you are not able to hear well in that ear. Sometimes you may even hear air entering into your ear. So how this happens is, when you hit, what happens when you give a slap, the impact causes excessive pressure on the eardrum, and it perforates the eardrum. So when you have suffered a slap, and when you hear ringing sound in your ear, and when you feel that the hearing on that side has diminished, and that you are hearing a hissing sound, this indicates that you have suffered a perforation in your eardrum due to the slap. So what happens? So don't immediately seek first aid for this problem, because there is no first aid. Nature knows how to heal. So you need not put any eardrops. The first thing you should not do is, don't apply eardrops at all. So when somebody slaps you, and when you feel that there is a hissing sound, and you feel that there is a ringing noise, then you feel that you have lost a little bit of hearing from that side, immediately don't panic and put eardrops. If you put eardrops, what happens is the healing will be delayed or even hindered. So don't use eardrops for trauma. So all you got to do is keep the ear plugged. Even if you don't see a doctor, that perforation will heal on its own in 3 weeks time. I repeat again, even if someone hits you, even if you have suffered a small perforation in the eardrum due to trauma, don't panic. Don't put any eardrops. Just put cotton ball, and ensure that you don't take head bath for a couple of days. Ensure that no water does not enter into your ear. It will heal on its own in 3 weeks time. So you need not even seek medical attention. If you are fairly sure that you're not having pain, you're not having any discharge from the ear, you can be fairly sure that it is going to heal. The only time you need to seek medical attention is in this condition. I mean that if there is pain or if there is discharge from the ear, you should seek attention. Otherwise, it will heal on its own. The next common thing which the patients are very much worried is the presence of wax in the ear. So let me tell you, presence of wax is not a disease. I repeat again, presence of wax is not a disease. If the ear does not have any wax, the ear is not normal. Let me tell you, a wax-free ear is not a normal ear at all. A normal ear should have wax. Why? Nature has devised this unique way. It protects the skin lining of the ear canal from moisture. So what happens is, whenever you are taking a bath, water tends to get into the ear. When you wash your face, water tends to get into the ear. When you go for a swim, water tends to get into the ear. So what happens is, it is actually a crucible. It's a small crucible. So what happens? It has only one way of entry and one way of exit. So whatever water which is inside the ear will stay there. It won't come out on its own. You need to take extra steps to dry the ear. So ultimately what happens is, the duration of the external aortic canal skin's exposure to moisture again will cause excessive damage to the canal skin. In order to prevent that damage to the skin, this cerumen or wax is there. It serves as oil. It forms a oil coating in the external aortic canal, so that water does not harm your skin. So yeah, don't worry if you have an oily body. An oily body is wonderful because water is not going to harm your skin. So oil is really wonderful. I always advise my patients to use coconut oil liberally. Whenever they want to go for a head bath, I advise them to put 2 drops of coconut oil into the ear before they apply some coconut oil to the head. And I will also like them to apply oil even to the skin, because oil really adds not only luster to the skin, it really protects your skin from moisture, from water, and from other drying agents. So even you would have known that some of you would be using moisturizing soap. Moisturizing soap is nothing but a soap with extra amount of oil added. So now they have even come out with soaps made out of coconut oil. See, these things, why you want to wait for these products to be launched? You have these products right in your home, and it is there sitting in front of you in your dressing table. And I'll advise you to make liberal use of your coconut oil. So whenever you feel that you are having wax, the best thing to do is just keep on applying coconut oil before you go to bed. When you feel that your ear is clogged, when you feel that your ear is a little bit itchy, whenever the when you feel you are having a itchy ear, you should be alert that the wax is forming actively and it is just peeling out. So whenever your ear itches, it tells you that it seeks your attention of the fingers. So it provokes you to put your fingers there. Sometimes you will put a earbud. Sometimes even you will put a star. You will put a safety pin. You will put whatever sharp things you have. You will attempt to use it and put inside your ear. But never do it. Even your Johnson's earbuds are not supposed to be used for cleaning the ear. I don't know how many of you have seen the packet. Whenever you buy Johnson earbud, they would have given it a warning saying that it is not meant for use inside the ear canal. It is meant for use only outside the pinna. So pinna, behind the pinna you can use. You are not supposed to use it within the ear canal. That's a clear-cut warning they would have given in all your even Johnson earbuds packet. So I would advise you to use earbuds. A lot of people, a lot of my patients, what they do is they make a earbud from their home, what do you call, things available at home. They will use a small broomstick and wind the broomstick with cotton, wisp of cotton, and use it as a earbud. Two things can happen. One is it can break and get inside the ear, or the cotton will come out of the stick and will be staying inside the external aortic canal. And they will panic and they will call me in the dead of the night. So, sir, what has happened? See, my earbud has got stuck into my ear. So you need not panic. Again, I'm telling you, you just forget it. Okay, earbud is there. It is not going to kill you. Just wait for the night. The next day, say, while the doctor is coming for the consultation, just go to him in your leisurely way and then give him the time to remove, and he's going to remove it for you. So never panic. The first thing you're supposed to do whenever the earbud gets stuck inside your external aortic canal, for heaven's sake, don't panic. For heaven's sake, don't attempt self-removal, or don't ask anybody else to remove it for you. You wait, go to a doctor and ensure that it is getting removed in a safe environment. Always when you want to remove a foreign body, it is ideally removed in a safe environment. The safe environment is a must for safe removal of the foreign body. So you should always ensure that You don't put any buds or any sharp things into your ear canal. So if you are having a itchy ear, the first thing you do is just liberally apply coconut oil. You need not put, just, it is not sufficient to put 1 or 2 drops. You need to, again I'm telling you, you need to fill the entire canal, external canal, with your ear oil, coconut oil. You need not heat, you need not add camphor to it. I repeat, you need not add camphor. And then camphor is a huge irritant, so never use camphor. So just put coconut oil, raw coconut oil will do. And then close the ear canal with a cotton speaker. Just put a small cotton roll inside the ear, plug the ear canal, so that the excess oil will stay there. So what happens is the oil will liquefy, will soften the wax. The next day morning, when you remove the cotton wisp, you will see the wax sticking to the cotton wisp. So that is how you can remove your wax. Genetically, some of you may have a tendency to form hard wax. Suppose if you have a tendency to form hard wax, don't worry. A liberal application of coconut oil is sufficient to remove the wax. And if you still feel that you are not able to get rid of it, then you seek medical attention. Let me tell you, the commonest cause of deafness is presence of wax in the ear. I repeat again, commonest cause of hearing loss is presence of wax in the ear. So always don't fear wax. Wax is pretty normal. Wax with ear without wax is not a normal ear. I keep on repeating, the ear without wax is not a normal ear. So normal wax is actually a normal thing which everyone should have and will have. The next thing which you should know is, as you grow older, what happens is, so every one of you will know, the moment you turn 40, what will happen is you won't be able to read from your book. You will feel as if the distance at which you're going to hold the book, it's getting farther away. So you need to hold the book a little farther apart for you to read. So you start wearing reading glasses. This is what we call presbyopia. So you need to have a reading glass. The same thing happens when you, with your hearing also. So what happens is, when you grow older, every organ starts to slowly degenerate. So as with your eye, the ear also suffers a loss of efficiency. So what happens is, this loss of efficiency always starts with the higher frequency. So this loss, usually this perceptible loss, will start from the 5th decade of life. So around about your 50th year, the first thing you will feel, I don't know how many of you are 50. I don't know how many of you would have realized this. So at the age of 50, what will happen is, the starting the rainfall, it's the start, see, when the rain starts to fall, you hear a small noise. So that noise will not be heard. The water tap dripping noise will not be heard. So the rain which starts when you're inside a room, you have closed all your doors and windows, you won't hear the patter of the rain. If you're not able to hear the patter of the rain, that will tell you, Are Baba, I'm old, I'm getting old. Don't panic. It's nature. You will have to accept that you're growing old, and you should also grow old gracefully. You accept aging. Aging will happen to everybody. You, me, and everyone, our children, our grandchildren, everybody is going to age one day or other. But you should teach them how to age gracefully. We should age gracefully. The more old we become, we should realize that these are the things which are likely to happen. There should not be any surprises around the corner. Supposing if you don't know that, say, at the age of 50, you may not hear the early sound of rainfall, then you will panic. But if you know that this is going to be there, nearly 90% of the people at the age of 50 will not be able to hear the early rainfall falling sound. That is universal. That is normal. That is a normal for that age. So that you should research. That is the first thing which will happen. The next thing which will happen is, say, around about 60th year, you may not hear, or you may not be able to comprehend what your daughter or wife speaks. I repeat again, at the age of 60, your daughter or wife will not be able, you won't be able to comprehend. I'm telling you, you will be able to hear them, but you won't be able to comprehend. You won't be able to understand your daughter or your wife's spoken words. So I know a lot of people at the age of say 60s and 70s, they have a huge fight among spouses. The wife will say, you are preferentially deaf. You whenever you are able to hear a male talking, you when I talk, you feign deafness. You are preferentially deaf to my voice. That is a common complaint which a wife makes about her husband, or a daughter makes about a father. But the reality is, you should always remember, a female voice is of a higher frequency than that of a male voice. I repeat again, a female voice is of a higher frequency than that of a male voice. So what happens is, as you grow older, this uh, deafness, your cochlear hair cells slowly starts to degenerate, and you will lose the ability to understand the high frequency sounds. So ironically, the high frequency sounds are commonly, I mean, women and wife and daughter, they speak at a higher frequency, and you may understand that something is being told to you, but you may not be able to comprehend the meaning of what is being told. So that is the reason why, if they speak from behind you, if they stand in front of you and speak, what happens is, subconsciously you tend to read their lip. You tend to read their lip, and you are able to fill up the blanks, and you are able to somehow manage and understand or comprehend what is being told to you. But the moment they are in another room, or they are behind you, they are out of your eyesight, what happens is, this is a huge problem. So every one of you, I will really appreciate if the female listeners here, they should understand, say a 60-year-old male may not be able to hear or comprehend what they have told. That is nature, because they are really preferentially deaf to that frequency. So that should be understood. So that is the reason why I am stressing this again and again. So the common problem is, say, around 70 or 80 years. So we see people commonly reach 70 and 80. So at the age of 80, you will have only 60% of the normal hearing left with you. So you need to decide whether this 60% is okay for you. So what happens is, somebody will say, so I am not happy with 60%. I need at least 80%. So they are the perfect candidates for hearing aid. So you never hesitate to seek help when you feel that your hearing is really creating problems with your normal life. So that is a dictum. So when to seek attention as far as this hearing problem goes, when you feel that you are really constrained in your workspace. So when you feel that you are not able to cope up with your workspace because of this hearing disability, or this aging hearing loss, you should seek help. So let me tell you, the hearing aid is the best way to augment hearing in your old age. For example, 70s and 80s, never hesitate to go in for a hearing aid, because hearing is one of the most pleasant senses which you're supposed to enjoy. And every one of you should enjoy that sensation at least to the maximum till you breathe last. So that is the reason why I always advise, say around 70 or 80s. 80s, definitely what is likely to happen is, the hearing loss will be around 60%, 50 to 60%. So they'll be having a TV volume around 40s. When commonly when they come to you, when you ask them, they will say that when they come to me, they'll say, I don't hear properly. Then I'll ask them, first question I ask is, what is the volume which you use on it when you see your TV? It will be around 30s and 40s. If it is 30s and 40s, the bar which you see on the TV screen, when they use 30s and 40s as the TV volume, so definitely they need help. So it is always better to seek help when you feel that you are really constrained, and you're feeling that there is real difficulty in leading a normal life. So when you go out, the hearing needs to be intact, because you need to cross the road, you need to listen to traffic, you need to listen to the horn, vehicular horn. All these things are there. This is actually a organ which is meant to ensure that you're safe and alive. So there's no point in ditching that safety net for just for the sake of what you call cosmetic reasons. So many of you may feel uncomfortable wearing a hearing aid. You are pretty comfortable wearing a specs. I can't see why you are not comfortable wearing a hearing aid. The currently available hearing aids are all very, very aesthetic, and they add view. In fact, currently there are many hearing aids which can be attached to a spectacle. Supposing at the age of 70, definitely you will need a pair of spectacles for you to see. So you can embed your hearing aid into a spectacles. That is always there. And then you can always put in a intracanalicular hearing aid, a hearing aid which will be properly seated entirely within your ear canal. So that is also a possibility. Of course, the more smaller device you want, the costlier it is going to become. That, let me warn you. The smaller the device, the costlier it is going to work out. And then again, in old age, you may not be able to manipulate these small devices. So you need help. So you need to factorize all these things before you go in for a hearing aid. The commonest cause of early loss of hearing, say due to degeneration, due to cochlear degeneration or inner ear problems, is going to be noise induced. Supposing right now your traffic is real hell, the honking of the horns, when you are exposed to constantly around 80 to 90 decibel of noise, say 6 hours or 7 hours a day, definitely you will lose your hearing, nearly 30 to 40% of hearing by the time you reach your 50th year. So what should happen in your 60th year will happen at your 50th year. So 10 years before, you will start losing your hearing. So always you ensure that you are not exposed to excessive noise. But that is easily said than done. So first, let us take the first step of not honking unnecessarily when you are on the move. So never honk on a signal. When you are on the signal, you need to wait for the signal to turn green. So why don't you wait patiently? I have seen people honking when there is a red signal light. Oh, there is no need to honk. And never unnecessarily put your fingers on the horn button. I feel everybody, they want to keep on honking. That is what you are trying to achieve by honking. I just can't understand. So never, for heaven's sake, unnecessarily use your horn of your two-wheeler or your four-wheeler. This is because common cause of this honking is you are feeling too stressed. You want to reach your destination that fast. So that is the reason why the traffic is slow moving, you feel, when you honk, you have a feeling that it will move faster. This is not going to happen, because for you to move, the fellow in front of you should move. For him to move, naturally the signal should be green. So you need to, if you decide that I am not going to honk tomorrow, and that is one issue which we will take it in a positive sense, because horn sounds are the worst culprits. They create more damage to the ear than all the other insults put together. So never honk. They ensure that you always prefer a noise-free environment. So I feel kids going to the pub. Pub is the noisiest place. They play music at, say, 110 decibels. On top of it, they'll start screaming and dancing. These are all insults to your very, very gentle, tender sense organ, that is your hearing. So you ensure that you avoid noisy environment. By avoiding noisy environment, two things you are going to achieve. One is you are going to retain the pleasure of hearing for 10 more years. Let me tell you, supposing if your hearing is going to start its perceptible degeneration by the age of 60, if you are going to start that problem at the age of 50, that's a pathetic disaster. So I will really advise every one of you to reduce your noise production as well as avoid noisy environment. And you may be curious, you may say, okay, I will wear a ear muffler. Yes, ear muffler you can wear, but still noise is a noise. Yeah, 100 dB, your horn, the common horn which your bike or car uses these days, they generate 80 to 100 decibels of sound. So 80 to 100 decibels are really huge noise, let me tell you. And this combined with all the vehicular noises, that is going to really play havoc with your hearing. So the noise-induced deafness is the most common cause of sensory neural hearing loss. Because these persons, even if you're going to give hearing aid, we are not going to restore the pleasure of hearing 100%. So we need to be very careful with them, and we need to go for the costly hearing aids to ensure that they get the benefit. So it is always better to avoid than get into this problem. So let us avoid noisy environment in the first place. Avoid pubs. Let me tell you, as a parent, I won't like my kids. You can go out and enjoy, no issues. But pub is a worst place because, personally speaking, not because of the liquor, noise. Noise will literally destroy your hearing. So ensure that you avoid pubs. You enjoy other ways. You go to malls, you go to movie theaters, you can go to any place, but avoid this noisy pub. So that is one thing which I will keep on stressing again, and again, repeatedly, to ensure never go to noisy environment. Even if you go to a noisy environment, ensure that you stay out of that environment for a considerable period of time. So don't for heaven's sake go every day to a pub. Say maybe if you go for a monthly once, fine. Next question your parents will love to ask me is, what about the earphones? Yes, earphones. Again, it gives a lot of pleasure when you hear lovely music, but the current music, which is full of bang bang bang, and really causes a lot of noise. Music should be melodious and ideally put you to sleep. So good music will always put you to sleep. So uh, the enjoyment quotient of a loud music is really that much lesser. That is, I feel at this age, yes, maybe in your age I would have felt that, definitely I would have felt loud music and these bang bang is nice. But at this age, I feel that it comes out of maturity. Maybe I like every one of you to feel the same, but it's difficult to be in your shoes. I understand. So avoid listening to music using your headphones. That is one thing I really advise you. Instead of using the headphone, use your speakers. The speakers really, you can't increase the noise above a certain limit in your speaker, because your mom will come inside the room and start yelling. You're creating a lot of noise. So never use your headphones. Use your speakers to listen to music. The speakers, a good quality of speakers these days, nowadays the speakers available are really good. Let me tell you, they're really good. So it is always better to use speakers than your headphones. Headphones are meant only for telephonic conversations, a private conversation which you don't want others to listen to. So it's always better to avoid headphones when you listen to music, that too when you listen to music. But let me tell you, one thing I really found out, curious enough, was the use of Bluetooth headphone. Bluetooth headphone does not increase the noise quotient. There is always a sound bar. You can't increase the volume above a certain limit. So if you want to use headphone, you use a Bluetooth headset. That is much better than the wired one. The wired one will faithfully reproduce a volume which you set inside your mobile or in your music system. But if you use a Bluetooth set, I think they have a inbuilt circuitry which reduces the noise and reduces the amplitude of sound, and thereby it gives you the good spectrum of music. So if at all you want to listen to music using a headset, don't use the wired one, use the Bluetooth one. So the next thing I want every one of you to know is the next precaution. Some majority of us will love to go for a swim. So when you go for a swim, so if you go to a swimming pool, there are two different things: swimming in a ocean or sea, and swimming in a pool. Pool is actually a fresh water. Ocean is salt water. So there are two different entities. Supposing, let us assume you go for a swim in your pool. The pool is highly chlorinated. Every swimming pool, they would have chlorinated the water to such an extent. The moment you dive into the pool, you will smell chlorine. So that is the amount of chlorination that takes place to maintain hygiene of the pool. So what happens is chlorine is an excessive irritant on the skin. And if you want to go for a swim, you ensure that you wear proper earplug. Without earplug, don't go for a swim. So ideally, you need to choose a good earplug. How are you going to choose a good earplug? You put the earplug in your ear, and you should, the noise should be cut off. And when you start speaking, the voice should echo to you. So that is the quality of earplug which you use when you are going for a swim. So don't swim without your earplug. If you swim without earplug, what two things are likely to happen? Your external canal skin will become itchy, and then you will tend to use your earbuds to scratch the external canal skin. Then you will land up with pain in the ear. The external canal pain is very, very painful. Even you won't be able to chew your food if you have pain in the external canal. The moment you open the jaw, the pain will be so much that you won't feel like eating at all. So why land into such problems? So always use earplug when you go for a swim. Even when you go for a swim in an ocean, again, you ensure that after you complete your swimming in the ocean, go and take a bath in fresh water. Go and take a bath in fresh water. That is the next thing you should do. When you go for a swim in the ocean, always ensure that you go back to the, immediately rush to your bathroom and then take a freshwater bath and clean your skin, because the salt water again will macerate your skin, will macerate your external artery canal skin. And always ensure that you wear your ear plugs when you go for a swim. And when you go for a dive, that is really problem, because when you go for a dive, if you wear a ear plug, you will land up with problems. So when you go for a dive, you should not wear a earplug. You should wear what you call as a complete headgear. You call it as a complete headgear. So complete diving gear. You should wear a diving gear. So don't attempt to dive with your earplug on. So now don't attempt to dive with your earplug on. If you want to dive inside a pool, you use your complete scarf like covering. This complete scarf like covering is available for divers. It's called diver's cap. So use a diver's cap which will closely cover both your ear, and then when you dive, it won't be a problem. If you use your ear plug and start to dive, jump into the pool and dive from the diving board, what happens is the sudden increase in the pressure will traumatize your eardrum. So that precaution you should take. So these are all the small basic precautions you can take to ensure that you retain and enjoy the pleasure of this wonderful sense organ till you breathe last. So that is, I always say, God has given you a wonderful sense organ. You ensure that you keep it working till you breathe last, and enjoy the comfort and enjoy the pleasure these sense organs gives you. Thank you very much. I'm open to questions if you have.
Thank you so much, sir. From your talk and seeing the questions here, I can see how many people would have asked the repeated questions to you again and again. Because while talking itself, he wants. Yes, sir?
Yeah, tell me. I'm listening, please. I'm listening.
Because most of the questions here have already been answered by you. That how many times would have people asked you the repeated questions? So let me read.
Cochlear, I'm not able to hear you. Cochlear, you're mute. You're muted now. No. Okay, start. Cochlear, you gone into
let
mute.
me. Yes, sir.
Cochlear, you gone on mute, ma.
Hi, sir. Very sorry for the inconvenience.
No problem.
Okay.
Sir, first question is from Praduman Singh. He's asking, cochlear implant has some disadvantages, still it's getting famous. Why is that?
let me tell you one important thing. Cochlear implant is a real boon, and it should be used only on specific conditions. What specific conditions? The child should be deaf as well as dumb. The speech should be affected, and the child should be having profound hearing loss, and even a use of a hearing aid will not be sufficient to improve the hearing of a child. So that is a stage when you should contemplate on cochlear implant. And cochlear implant, if done within the age of 6, will have a better effect than in any other age. So it should be done as early as possible. And let me tell you, I have heard children, deaf and dumb children, sing after implant. So it is a real boon. And Government of India and Government of Tamil Nadu, all the state governments, they have gone extra yard to ensure that this cochlear implant program reaches the length and breadth of the country. And in fact, a lot of cochlear implants have been performed, and with currently the degree of success is also huge. I'm really enthused by the cochlear implant technology per se. It's really good. It really helps a lot.
Thank you, sir. Sorry for the inconvenience in the middle,
No
because my parents were listening to you on the other end of the room. I had to ask them to mute. The questions from my parents, sir, I want to ask that.
Sure.
Right from the beginning, we were mentioning about pouring coconut oil into the ear. They asked the most common thing that people use from our side is gingerly oil, the sesame oil.
Any oil can be poured. Coconut oil doesn't mean coconut oil. Ginger oil also can be poured. Because I use the term coconut oil because that is a common oil which you use for your hair. So the same thing, it is easy to use in your ear also. That is why I use coconut oil. Almost ginger oil and coconut oil are the same, and there is nothing wrong in using one in place of the other. No problem.
And also, you mentioned that adding camphor will irritate the ear.
Yeah.
But there is a practice here, heating the oil with garlic and then cooling it down and then putting in the ear. Is it also bad, sir?
No. If you cool it, no problem. If you are going to pour, say, above 7 degrees above your body temperature, it will stimulate your labyrinth and you will immediately feel giddy and vomit. So it should neither be too hot nor it should be too cold. It should be ideally in your body temperature. When you touch, it should be, it should not be too warm or too hot or too cold. When you put your finger inside, you should feel that you are touching a body.
Okay, sir. So using garlic is not a problem.
No, that is not a problem. That is not a problem. Camphor is an irritant, let me tell you. Camphor irritates the skin.
Okay, sir. Rashni, can you ask the next question?
Yes. So we spoke now about oil and all. So there is one question related to that. Sir, you repeatedly many times said that we got to fill the ear canal completely with coconut oil. So here the doubt from Bhavani is that won't the oil apply any pressure to the eardrum and then leak into the middle ear?
It is not possible for oil to leak into the middle ear because the eardrum is not perforated. And the oil does not cause any harm to your ear. And just by simply filling the ear canal, you are not increasing the pressure at the level of the eardrum. It doesn't work that way. You will feel a little bit full in the ear. You will feel fullness in the ear because of the presence of oil, but it is not going to cause any harm. On the other hand, the wax will liquefy, and oil acts as a solvent. It will liquefy the wax, and the wax will come out with the cotton which you have used to plug the external aortic canal.
Sir, we have a question from Singaravelu. Sir, you said for ear wax, just put oil to the ear. How the wax gets cleansed out, sir? Because after putting oil itself feels like something is obstructing and itching. Then what do we do, sir?
No, actually, initially, when you put oil and plug the external aortic canal with cotton before you go to bed, what happens is the oil acts as a solvent. By the term solvent, the solvent is something which will dissolve the wax. So oil will dissolve the wax, and the excess oil along with the wax will come out when you remove the cotton ball. So that is the amount of oil you should apply. So the more amount of oil you apply, supposing if it is a very hard wax, you need to apply oil for 10 days, then only the oil will get into the external artery canal. You won't be able to pour more oil into the external artery canal in the presence of excessive wax. So on a regular basis, if you keep using oil, you can prevent this accumulation of excessive wax in the external artery canal. In fact, it is a prevention rather than a cure. If you keep on applying, the wax will not accumulate to that extent.
Thank you, sir. So the next question will be from 𝗧𝗙𝗏𝗧𝗧𝗏, sir. He is asking, what advice do you have for pilots, frequent flyers who are subject to frequent pressure changes in flight?
Sorry, I really did not cover this aspect during my speech, but it's really nice you brought it across. So what happens is when you're flying, but the currently available flying machines, they're all highly pressurized cabins. Even in pressurized cabin, the sudden descent or ascent will cause a certain amount of discomfort in your ear. So that is the reason why I always advise frequent flyers to use bubble gum. Or if you don't want to use bubble gum, at least you keep sucking a toffee. So when you keep sucking a toffee when you are flying, it will really equalize your middle pressure and it will keep your eustachian tube open. So if you are having, the problem will occur when you are having cold, when you are attempting to fly with an episode of cold. If you are having a nasal block and if you are having an attack of cold and if you are forced to fly, that is the time when you really face the problem. So you need to consciously carry a sweet with you. That is the reason why in many of the airlines, I don't know, and many of the airlines, they have this habit of offering you toffee as a gesture of welcome. But it doesn't mean, it is not a gesture of welcome. It is actually, they should tell you that you should suck the toffee while you are in flight. But if you keep sucking the toffee, it will really keep the eustachian tube open. Even now the airlines, they offer you a welcome toffee, and that toffee has got a real meaning because it really prevents your ear block when you keep sucking it.
Thank you, sir.
Sir, one question from my side. Actually, we can resist from hearing a loud sound using Bluetooth and things, like avoiding other wired connections. But there are still some industries where there are a lot of noise pollution. So, what kind of care the workers out there can do?
Actually, all the industries which are known to be noisy, they are supposed to provide ear mufflers. They are supposed to provide ear mufflers to all their employees under the Labor Act. And let me tell you, they are supposed to do hearing examination to all their employees in the factory floor. The noise is maximum at the level of the factory floor. So they need to undergo periodical audiological evaluation like audiogram. So the moment what happens is, the hearing loss due to exposure of the noise occurs in two phases. The first phase is transient one. It is called transient sensory neural loss. So when what happens is, the transient threshold shift is temporary in nature. The moment you remove the person from the noisy environment, he will get back his hearing. So as long as the person is in the temporary threshold shift, so you need to pick up those persons who are in the temporary threshold shift or a temporary phase of noise-induced deafness. You need to pick them up, give them paid holidays, ask them to go out, to stay at home, and then get back after 7 days. So 7 days to 10 days is actually the ideal recovery time for persons who have been constantly exposed to 110 decibel of noise, say at least 6 hours a day. So that is the industries or factory act specifies. And on top of it, you are supposed to wear mufflers. So actually that is the practice. You are actually the best practice in the which is supposed to follow in the factory floor is always wear ear mufflers and then go for regular audiological evaluation. The moment you are going into the temporary loss of hearing or temporary dampening of hearing, or what you call temporary threshold shift, get away from the floor and ensure that you take that 7-day or 10-day break from the floor. You can take other jobs, but ensure that you don't go to the factory floor for 10 days. Then you will get back, regain your normal hearing. And during that 10-day period, you ensure that you take a lot of fresh vegetables, you take a lot of salads, so that it will strengthen your auditory system.
So there's a question from my family. Yeah, you can go on, Vashin.
Like those people, are they only susceptible for hearing loss, or do they have some other ailments cause of that loud noise out there?
Actually, loud noise not only cause loss of hearing, it causes lot of mental irritation. So you see these workers who spend a lot of time in a noisy environment, when they reach home, they're highly stressed, and they have a tendency to yell at their spouse. They have a tendency to yell at their children. That is not because they are angry, it is because they are excessively stressed due to the presence of excessive ambient noise. We use the term ambient noise or the environmental noise which is prevailing in the factory floor. So it needs lot of understanding among the family members. So you should know that your parent is working in a factory, and you should also know that it is a noisy environment the parent is working. So at that time, when they tend to be jumpy when they reach home, so you give them that space, you ensure them the atmosphere is calm, and you don't start yelling, you don't create noise within the home, you ensure that a little bit of silence is available in the home. You calm down the nerves of your parents. That is your duty as a child, or as a son or daughter. When you feel that your father is working in a factory floor, and you know pretty well that it is going to be noisy, you give them that space, give them that peace of mind, so that say in another 2 or 3 hours of silence, they will definitely get back to their usual self. But when they reach home, let me tell you, let me warn you, they will be jumpy only. So don't try to play on those jumpy nerves as soon as they reach home.
Thank you, sir. Over to you, Janice.
Sir, can we use hearing aid for 1 year for an old man who is 80 years old? Is that enough?
Let me tell you, the decision of hearing aid is purely financial and personal. That is the first thing I go. There's something called cost benefit ratio. So the patient should be the ultimate beneficiary and not the manufacturer of hearing aid. So going by the cost benefit ratio, I will say, if the person, old person, say about 70 or 80 years, they are not going to be actively moving out on the streets. If they are not actively moving out on the streets, hearing aid to 1 year alone will do. Supposing if they say that they are constantly going out, they are very active, they are going out on streets, when they have a tendency to go out on streets, it is better to have hearing aid in both the ears. And hearing aid should always be worn in the better hearing ear. I repeat again, if you have hard of hearing or deafness in both the ear, you should wear the hearing aid in a better ear rather than in your worse ear. If you want to get operated, you better get operated in the worse ear rather than the better ear. If it's going to get spoiled, let the worse ear get spoiled. That is the mantra, right? You understand my point? If you want to wear a hearing aid, you ensure that you wear it in your better hearing ear. And if you want to get operated, you get operated in the worse ear. Suppose even if your hearing is going to be damaged due to the reporter's freaky surgical issues, then let the worse ear get damaged rather than the better ear. That is how the rule of the thumb works.
Thank you, sir.
Thank you, sir. Now, the question is from 𝗧𝗔𝗡 She has two questions. First thing is, sir, you said for ear wax, just put oil to the ear. How the wax gets cleaned out, sir? Because after putting oil itself feels like something is obstructing and itchy. Then what to do, sir?
So if you start applying wax cannot dissolve in a day's time. Let me tell you, you need to use coconut oil or a ginger or whichever oil you prefer, at least for a week or 10 days. And the more frequent you use, the more amount you use, the better are your chances. Usually it takes a week or 10 days to come out. You got to be pretty patient with it, because even if you go to a doctor, doctors should not attempt to remove wax immediately. They should ensure that it is liquefied to that extent. The moment they use a syringe to push water into the ear, wax will come floating out. That should be the consistency of the wax. So many of you would have gone to a doctor, would have got your wax removed by syringing the ear. So before syringing, the wax should be reasonably soft and reasonably liquefied for the syringing process to work. So for that to happen, you should have applied coconut oil or any other oil. The doctor would have prescribed you Solivax, but Solivax is pretty expensive. The same job will be done by your oil. So I always prefer my patients to use oil rather than the proprietary Solivax. Yeah, the oil is freely available in your house. So why not you choose it, the free option? I mean, I don't use the free, it's a cheaper option.
Thank you, sir. I think that's all for the question and answer session. Do any of you have any other questions? Do you want to add on to anything?
Nothing much. If you're comfortable, fine. Just
Okay, sir.
okay.
Thank
Thank
you
you.
so
Thank you. Thank you.
much, sir.
Thank you so much. Thank you, Mata.
Thank you, sir.
Thank you. Thank you.
The session was very, very informative. Thank you so much, sir.
Thank you, Ma. Thank you. Thank you.
Sorry to interrupt. There are 2 questions.
Yeah,
put
sure,
up
sure.
in the YouTube.
No, tell me.
We have a question from Samir. Does long-term pain in ear that's just been caused by hot and cold water? What might be the reason, sir?
I don't get the question. Can you repeat it again?
There's a long-term pain in the ear that has been caused by hot and cold water.
Normally, hot and cold water does not cause pain. It causes giddiness. Normally, the exposure to hot water and cold water in your ear, before it causes any pain, it causes intense giddiness and vomiting. I don't exactly understand the question actually. You just, if they're very pointed, if they ask a pointed question, yes, it only will cause giddiness rather than pain. It will cause giddiness and vomiting. Too hot or too cold. If it is too hot, maybe it will burn the skin. That is there. But if you use a hot water for bathing, if you put the hot water into your ear, you will feel giddy.
Okay, sir. Next question is from Ashil. Sir, how different is the sound heard by patients using hearing aid and cochlear implants? Is it natural?
Yeah. That is another thing. Since this topic was supposed to be for lay persons, I did not touch on it. So let me tell you, the normal sound we hear, supposing water, when I say water, you are able to hear water, you are able to perceive water. Some of you may visualize water, some of you may even smell water. So that is how it works. Whereas a child which has not heard the term water, which does not know what water is, if it is given a cochlear implant and if the term water is uttered to it, it won't be heard as water, it will be heard as something else. So what that something else only the child will know. I repeat again, how the cochlear implant sound is going to be heard or perceived will only be heard by the individual who has undergone the implant and not by the surgeon or any outsider. So that is the hard truth I want to confess. If you ask me how the term water is going to sound for a cochlear implantee, my honest answer is going to be, I don't know. Only the child will know. So there they have a rehabilitation teacher. The teacher, what the teacher will do is, the teacher will sit in front of the child and start saying water. Put a cup of water in front of the child, say, this is water. Keep on saying, this is water. The child will say, okay, we'll hear some sound and will link the sound to the object water. So this is how the child learns to speak. And the second thing the teacher will tell us, we'll ask the child to see the lip moving. So slowly what the child will do is, it will start associating the lip movement along with the sound heard inside the implant and then associate with the object. So slowly what they do is, the first thing they respond is, they will say, bring the water. If you say, they will go and get the water, but they won't be able to pronounce water. The pronunciation, the exact pronunciation of water comes much later. So the development of phonemes, development of words are huge science, and it takes nearly 1 year for the child to develop enough vocabulary after cochlear implant to converse with you.
Thank you,
Thank you,
sir.
sir.
Thank you, ma.
We actually got to know something new about the cochlear implants.
Oh, I mean, the
And,
topic was actually, since it was actually meant for lay persons, I did not speak much about it, but it's a huge, it's actually one of the major scientific advancement in the current century, I should say. Thank you very much. Thank you very much for patient listening.
So hoping that you all had a good time and learned something new from the session. We take immense pleasure in thanking Dr. Balasubramaniam for sparing his time for us. Thank you so much, sir.
Varshini, before you sign off, why don't you
Yeah.
speak something about your organization?
Sir?
Why don't you speak something about your organization? You have organized a show, isn't it? You have run an organization. Speak something about the organization so others will know about your organization. You
Yeah,
kids are
sir.
running a wonderful show. Please speak something about the organization. Even I am curious to know.
Thank you, sir.
Somebody
Actually,
speak about your organization, please.
sure, sir. Can I continue?
Yeah, please. Welcome.
Hi, I'm Kokilawani. We are all from South Indian Medical Student Association. So the thought we had for conducting this event is to create awareness about the deaf people. We just planned it for a week to have this session. But now, since we've got to know a lot in this week, we want to continue this KOFOS. This KOFOS means deafness in Greek. We want to continue this throughout the year. We want to keep on having more number of events and everything related to it, because we got to know and we got so much inspired by all of you people. We had another webinar also, a teacher from a deaf and dumb school. He also told a lot about the deaf community to us. So now we want to continue this KOFOS forever. And about South Indian Medical Student Association, we are conducting a lot of events like this, not only about deafness and stuff. Many states are working on different aspects. Our aim is to empower doctors. Is Dina ma'am available? Ayushi?
Yes. Yeah. I'm there online, Kokila.
I would love if you add something to it, ma'am.
Yeah, I'm so sorry. Actually, my connection is a little weak, but I would thank sir a lot. I also got to know a lot of new stuff which I wouldn't have known otherwise, like how how the sound in a cochlear implant patient is different from that of in the normal person, how we hear sound differently. Also about the flying, and I am a frequent flyer, but not now because of corona. But yeah, a lot of us medical students, some of us, we do travel a lot, so it's nice to know some precautions we can take. So personally, these are the things which connected to me a lot. And apart from that, bugs entering the ear and everything is something we have seen in our OPDs as well. So that was it was a really refreshing talk, sir. So I would really thank you that you took your time out and gave this wonderful session to us.
Thank you. Thank you.
Thank you, Dina. Please add a little bit about SIMSA. That is what he wanted us.
Oh, okay. So what I can South Indian Medical Students Association, we started this year, sir. And we operate on 7 standing committees. So Standing Committee of Public Health, Rights and Peace, Sexual Health, Reproductive Rights, Gender Education, and Medical Education. Apart from that, we are operating in all these 7 states of 5 states and 2 union territories of South India. And we thought that since South India has a very similar cultural background, but obviously different languages are spoken, however similar cultural background, we can work as one whole unit and connect better and do community outreach programs better. And unfortunately, because of corona, we are limited in doing the on-ground work. However, we believe that through webinars, we will be able to reach out to more people and benefit more people. And we as doctors should be empowered as well. And we hope that happens.
Okay, ma. Thank you.
Thank you. Thank you, Deena. Thank you, sir.
Thank you, ma. Thank you so much. Very nice of you. Thank you. Have a nice day.
Thank you, sir. Thank you, sir.
Thank you.
Hoping to work with you or interact
Sure.
with you more in future, sir.
Please, you're welcome. You are welcome. I'm always there for you, ma. Thank you so much. I
Thank
love
you,
my
sir.
children. I love my youngsters. They keep me running. Thank you so much. Thank you.
Thank you, sir.
Thank you so much, sir.
Thank you.
So, can we do the live streaming?
Yeah.